season approaches and COVID-19 infections continue to spike, we are all on heightened alert. While the best thing that you can do to prevent this bothersome illness is to frequently wash your hands and, of course, get your annual flu shot, there are other practices you can do to boost your health and immunity this cold, harmattan, and winter season. Hi, I'm Dr. Hadiza Marliyya Suleiman, your favorite holistic reconstructive surgeon, and welcome to the Medical Information Channel's third live stream. Yay! It is also the first part of a three-part series of kick flu and colds and catarrh in the butt this harmattan. In this healthy harmattan and winter weekend marathon, I will be telling you 13 things you can do to prevent, help, treat, and soothe your common colds, your catarrh, and your flu this dry winter and harmattan season. It depends on where you live. So don't forget to get your Don't Get Sick checklist, and don't forget to support this channel by linking in the pinned comment below my comment after you watch it, of course. I would love that you interact with me during this live stream and get your questions and comments ready. Now is the time to put your health first by arming yourself with cold, seizing, and flu-fighting preventative practices, making it easier and less likely to catch a virus during the peak season of colds and flu. Yes, December, January, February, they are the peak seasons for flus, for colds, for catarrh. We may consider the common cold just as a nuisance, really, more than a health threat. But the rhinovirus is the leading cause of workplace absences and can lead to complications such as bronchitis, a streptococcal sore throat, and even pneumonia. The influenza virus can be even worse, causing great distress to your respiratory system, your airway. And as the temperatures continue to nosedive outside and more of us spend time indoors around other people, a cold infection can spread more easily, making it common for most of us to catch a cold from between 1 to 2 to 3 or even more times in a year, especially during this harmattan season and cold winter season. For me, the first 4 months of this year have been quite turbulent, or should I say were quite turbulent. I had a lot of colds, a lot of catarrh, and well, whatever else. The influenza, that viral infection, the influenza, also known as the flu, tends to be more seasonal around this period. And from December each year, millions of us contract the flu. And many more sick people will need to be hospitalized. They can't manage it at home. The influenza is a viral infection, also known, commonly as the flu. It tends to be more seasonal and it starts getting more serious around this time of the year, as I said. Millions of us contract the flu, and generally through the month of this same month of December, all throughout January, February, March of the following year, yes, the annual starts. The annual flu begins more in earnest. And so, please, I want all of us to get prepared. What is your strongest defense? Yes, against the flu, against influenza virus. It is vaccination. Have you heard of the flu shot before? The best way to protect yourself and your loved ones against the flu is to get a flu vaccine every flu season. And why should we do this? Well, this is because The flu is a contagious respiratory disease that can lead to serious illness, hospitalization, or even death. The Centers for Disease Control recommends everyone 6 months of age and older get an annual flu vaccine. And once that flu vaccine is administered to a person, antibodies are produced. So, what are antibodies? You may be wondering that. Antibodies are actually blood proteins produced in response to a foreign or harmful substance, which the body recognizes as an alien or a foreign substance. What are some of these alien or foreign substances? They could be bacteria, they could be viruses, as in this case, and other foreign substances in the blood. So when these antibodies, when these antibodies begin to develop in the body, in about 2 weeks or so after this flu shot, you are protecting yourself from these influenza viruses, all right, by doing this flu immunization or the flu shot, okay? Now, unfortunately, however, there is an unfortunately. Unfortunately, however, because each year there is a different virus causing the flu or causing influenza, no flu vaccine is 100% effective. But it is still effective. Should I say it is still important for helping in reducing flu-related deaths or flu-related risks from falling ill with the influenza virus. Okay? It can help reduce the hospitalizations due to the influenza virus. In some countries, like Nigeria, for instance, the influenza vaccine isn't actually a recommendation in the vaccine schedule. It's given only to certain individuals at risk of developing influenza, because for these individuals, it could be catastrophic if they develop the influenza virus. So it is advised for this certain group of people to get the flu shot. Have you received your updated bivalent booster vaccine against the COVID-19 virus yet? COVID-19 boosters are an important part of protecting yourself from getting seriously ill or dying from COVID-19, according again to the Centers for Disease Control. So please plan to get your updated booster of the COVID-19 vaccine if you've not already done so. Let me know if you've taken your booster dose of the vaccine shot. Please chat me in the comment section. So apart from the seasonal influenza and COVID-19, of course, I'm sure many of you know that there are many other types of viruses called the rhinoviruses, which are a family of viruses which are responsible for causing the common cold or coryza or catarrh that we commonly have during this harmattan or during the cold winter periods. And so, with all these scary viruses floating all over the air, what else can you do to help protect and optimize your health this harmattan or in other places the cold winter season? Let's continue. You can be physically active. Exercise to boost your immunity. Exercise now, more than ever, is being viewed as a form of preventative medicine. It not only reduces your stress, it can lower your blood pressure, reduce your risk of diabetes, reduce your risk of heart disease and stroke. But not only that, it can give an extra boost to your immune system. A strong immune system is vital in warding off germs and microbes just wanting to cause us harm. So if you haven't started with an exercise routine to reduce your risk of getting sick this cold and dry harmattan season, please do so. My 1.5 hour exercise routine will actually start as soon as I am through with this live stream. Guys, what else can we do? We need to drink plenty and plenty of fluids. Water, water, water. I cannot overstress it enough. And other fluids. It doesn't have to be water, but of course, water is the best. Not only that, you need to eat loads and loads of nutritious foods, fruits and vegetables. Mind you, they don't have to be entirely fresh if you don't have access to them. But I'm sure many of us have access to fresh fruits and vegetables wherever we stay. But if you don't, even the frozen and the canned sources of fruits and vegetables are better than not eating any fruits or not eating any vegetables at all, my people. Tomorrow, I'll talk to you about the foods you need to eat to kick flu in the butt this harmattan and cold winter season. I'll also explain to you why you need to take water when you have flu, okay? Or colds or catarrh. Now, did you also know that studies have shown an association between people with a low vitamin D status and an increased risk of developing the flu? Yes, vitamin D works with the immune system to lower levels of inflammatory proteins called cytokines within the body. And I'll talk to you about the kinds of foods you need to eat to get enough of this vitamin D to prevent you from flu and colds or to help ameliorate the effects of flu and cold on your body tomorrow, Allah willing. So please join me, okay? Now let's continue. Frequent hand washing. Wash, 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 wash. Frequent hand washing is one of the top ways of preventing and spreading germs. You remember? It was talked about frequently during, yes, the COVID-19 pandemic. So why? Why? Frequent hand washing is a must to protect yourself and others when coming into contact with contaminated surfaces or when you're touching other people. Remember, soaping your hands and scrubbing them for 20 seconds after you soaped them is the gold standard. So never forget to do this. The Centers for Disease Control, again, the guidelines are to scrub your hands for at least 20 seconds after soaping your hands. If you have trouble tracking, 20 seconds, for example, many of us don't want to count 20 seconds, okay? Do you know a simple way to help track yourself whether or not you've spent 20 seconds in soaping your hands? You sing the happy birthday song twice and complete it. Happy birthday to you. Happy birthday to you. Happy birthday, dear you. Happy birthday, dear you. Now, repeat it again the second time. Of course, slot in your name there, where the U is, okay? Now, why am I mentioning this? Again, let me just stress that, washing your hands the right way is a great way to keep the flu at bay. It also helps to clean and disinfect frequently touched surfaces at home, at work, or at school, especially when someone in your home is ill. Okay? Rushing this process can result in cross-contamination and increased sickness among people in the home or among people that frequently interact with one another. And can you believe that a 2018 report by the United States Department of Agriculture, the USDA, found out that up to 97% of us wash our hands incorrectly? That is horrific. Please and please manage your stress, all right? It doesn't help you to be stressed out in any way. Stress has been linked to a poor immune function. Your body will not be well. It will predispose you to developing infections. And of course, yes, viral infections like the flu, the coryza, the catarrh, the common colds. Sleep and reducing sleep is a great way to get, enough rest. And it's also a very natural remedy against the colds and flu. Have proper rest. Have proper sleep. Aim to sleep for at least between 5 to 7, 5 to 8 hours each night to enable your body repair itself properly to support a healthy immune system. Please and please, there are other ways to protect yourselves and others from this illness. Avoid close contact. Be smart when you're around sick people. Okay? I'm laughing. How? By not being around sick people. If you know they're sick. If you can avoid close contact with people who are sick, you'll go a long way to avoiding the flu or your cold, your common cold. If you're caring for a sick child, a parent, maybe your partner or your spouse, make sure to wear a mask and wash your hands often because, of course, you're in close contact with them. Or maybe you live, within the same vicinity. Or maybe you work together. All right. So just protect yourself. If you can, as I mentioned before, and I laughed, don't be around sick people if you don't have to be around sick people. Now, if you do become ill, you will also want to stay at home. You will need to rest because if you rest, it will support your recovery and prevent even you from spreading the virus to others. So if you're sick, please stay at home. Don't be a hero. If you show up to work or school sick, come on, please don't do that. You're risking other people, okay? Stay at home if possible. It's okay if you miss work. Work will continue without you, all right? It will always continue without us. It's okay if you miss even a Zoom meeting, Just stay at home and take care of yourself. Don't feel guilty if you're a workaholic, all right? What else? If all else fails, cover up, all right? If you are not wearing a mask and feel a cough or a sneeze coming on, cover your mouth or your nose, or cover your mouth and your nose. Flu and other respiratory illnesses are spread by coughing, sneezing, all those droplets coming out, and unclean hands. So sneeze into your elbow or sneeze into a tissue, all right? A tissue is better than a handkerchief because if you carry around your handkerchief, you're still spreading the germs. But if you just use a tissue and you dispose of it the right way, you're reducing your risks of infecting others with your various flu viruses, all right? Now, get medical help when necessary. Get medical help if what you're assuming is just the common cold gets worse with symptoms like, muscle pain, myalgia, or difficulty in breathing. That may be heralding something worse than just the flu. It may be something worse than just the common cold or coryza. All right, it may be something worse like the influenza virus or something else. So please get medical help when necessary. Once you start having symptoms that are worse than, just, a slight fever, some sneezing, some coughing, if you have difficulty in breathing, muscle pain, that could be something that's sinister. So take note. And then don't forget to click on your Don't Get Sick checklist in my pinned comment, in the pinned comment below, in the message or comment section. And don't forget to support this channel, the Medical Information Channel, by buying me a coffee. Now, make sure to practice these good health habits for prevention and treatment of the common cold. And I'll see you at the part 2 tomorrow at tomorrow's next 4th live stream on the Medical Information Channel. I remain Dr. Hadiza Marliyya Suleiman, your favorite holistic reconstructive surgeon. Ooh, I have some questions. I can see Amina Suleiman. Amina Suleiman said, oh, I lost that. Yes, live chat. Sorry, guys, I'm just trying to get the live chat. Yes, Amina Suleiman said, yeah, cover your body with warm clothes And please use the mask. Prevention is better than cure. She even had a little smiley with the face mask on. Yes, Amina Suleiman, that's fantastic. Cover your face with your face mask. Prevention is definitely better than cure. Thanks for watching the live stream, and I encourage you to join me again tomorrow in the part 2 of Kick Flu in the Butt this flu season. Bye.